Hi, episode 2. I guess after talking to the oncologist and being booked into the hospital, I had a biopsy on my lung to determine what type of cancer I had and whether the lung cancer was the primary source of cancer, which it was. So although I had a mass on my adrenal gland and the pain that I had suffered had been a ruptured adrenal gland or ruptured membrane of the tumour, the primary lung cancer was in my lung. It was in both lungs, in a lymph node in the middle of my chest, and obviously on my adrenal gland. So because of that, surgery wasn't an option because it had already metastasized. And as I said previously in my earlier video, I was told I had 6 months to live if we actually did nothing. So, of course, the first thing you do is you get booked in for chemo, and I was booked in for chemo, and I had my first session of chemo in November. On attending the hospital, I was told I'd be there for approximately 6 hours, but some things that should have been done prior to me attending hadn't been, so I had to be given steroids before I started the treatment. They give you the steroids basically to make you feel pretty good after the chemo because they know that you're going to have a very bad experience following the chemo because remember, it's toxic and it's there to kill the cancer, but it also kills all the other cells in your body. So following taking the steroid at the clinic or at the hospital, I was then intravenously given pembrolizumab, which is a very toxic drug, and that was given intravenously. I had an extraordinarily strong allergic reaction to it as they were giving it to me. I probably had only had a few milligrams, and I felt like my head was going to explode. And I said to them, "Is that what normally happens?" And they said, no, they stopped straight away, stopped giving it to me, called the oncologist. She asked them to fill me full of antihistamine, give me antihistamine, and then continue the dose, but at half the rate that they were giving it to me, which is what they did. And so 12 hours later, I was released from the hospital with my first dose of chemo, feeling pretty good, which carried on for the next 2 days because I was full of steroids. And then bang crash, it all came screaming to a halt. I couldn't eat, I couldn't drink. The only thing I could do was crawl into a bath, a hot bath, in and out of a hot bath, because that was the only thing that made me comfortable. Every joint, every limb, every muscle fiber in my body hurt. And so I was readmitted to the hospital on the Tuesday and given fluids and etc. until I recovered from both the pain and the result of the chemo, and sent home on the Thursday. So that was my first experience with chemo.